Today is the final episode in our Prolapse series, and we're talking about prolapse surgery. Let's go. Hi, I'm Jessica Ballant, a physical therapist and Pilates teacher, and I want to bring science-based knowledge, empathy, courage, support, love, and hopefully some fun to the journeys we have with our bodies. There is hope and strength in your body, and my goal is to help you find it. Hi, and welcome back to Meet Your Body. I, as always, am so happy to be talking with you today. We are talking about prolapse surgery. It is the final episode in our prolapse series, and if you have not listened to the prior two episodes, please go and listen to those now. I highly recommend listening to them before this one, but if you are ready to just dive in and you really just need to know about surgery, listen to this, but then definitely go back and listen to those because they're going to have a lot of information that you need if you are considering prolapse surgery. So in the first episode of the series, we just talk about what a prolapse is, symptoms, treatment, physical therapy, exercise, all of those kind of things. Then episode 2, we dive into the details of exercise, how to exercise with a prolapse. And then, like I said, today we are going to be talking about surgery. And one thing I really want you to know is that most people with a prolapse won't end up having surgery. It is not something that happens very commonly. You definitely need to be in a certain place with your prolapse to be a surgical candidate. So if you have just been diagnosed with a prolapse, and I mean in the last month, if you've just been diagnosed with a prolapse, and or if you have just a grade 1 or grade 2 prolapse, maybe put this episode on the back burner. Pause it right now, stop it, go listen to the other 2 episodes so that you can find out what you can do to empower yourself now, because many times grade 1 and grade 2 can resolve themselves. You are definitely not a surgical candidate if you have just recently been diagnosed and or you have grade 1 and grade 2. Also something to keep in mind, if you have recently given birth, which is very common to have a prolapse after giving birth, if you have recently given birth and you're still nursing, you don't know where that prolapse is going to end up because the entire time you nurse, up until about 6 months after you're done nursing, you still have crazy hormones raging through your body. Your tissues have not healed yet. And so you might have a prolapse now that actually resolves itself simply through being done with nursing and getting back to your normal activities and seeing a pelvic floor physical therapist. So I really want you to keep that in mind because I don't want you to come at this from a place of fear or again thinking that surgery is your next option when really it might not be. Now, the other side of that coin is there are some of you listening that surgery is an option for you. You are a surgical candidate. Maybe you have grade 3 or grade 4, or you've lived with it for a really long time. Maybe you've actually met with a surgeon and had a consult. And so in that case, yes, sit and take this information in, but make sure that you don't let yourself go to a place of fear. And I know that you will be in a place of kind of unknown. It is completely normal to feel that, to feel some anxiety, to feel that unknown. You aren't sure what's going to happen. You don't know what the right answer is. But just please make sure you stay in that place of knowing that there's hope and that you can make the decision that's right for you. And that's why I want to give you this information today. I want to lay it out in one place. I want to explain to you what prolapse surgery is, what they do during prolapse surgery, some things you should know before, recovery after, and then I'll tell you my personal story of having prolapse repair in 2019. So we're going to dive into all of that today. Also keep in mind, I have many resources and places where I've talked about my own story with living with a prolapse and my prolapse surgery. I have YouTube videos and podcasts about the sex after hysterectomy and just the reality of that and what to expect. I have YouTube videos on what to know before your surgery and what to know after your surgery and how to exercise with a prolapse and my own personal 1 year, 2 year, and 3 year recovery stories. So I'm going to have links to some of those below. I have a link to my primary free prolapse resource guide where you can find all of those things. So if I don't answer any of those specific questions that you might have, in today's episode or the previous episodes, please know that it's probably been covered in one of those places. So let's talk first about how to decide if you need surgery, if you need prolapse repair surgery. And I'm going to come at this from, again, a personal standpoint, but also as someone who's been a licensed physical therapist for over 20 years and has worked with countless patients having every kind of surgery under the sun, both after surgery and working with them prior to surgery. There's one thing I can tell you, which is you will never get to the point of knowing 100% that you want surgery. I just personally don't think that's possible. Surgery is a big deal, no matter what surgery it is. And I've had many surgeries for my endometriosis and then for the prolapse. I've had many, and never have I gotten to the point that I'm like, yes, 100%. I can't wait to do this. I'm so excited. And I think we kind of imagine that we'll get to that place, and you just don't. And that's okay. Like, that's normal, because surgery is a big deal and it's kind of an unknown. So take that pressure off of yourself. Another big thing I think is important to understand, especially with this kind of surgery, is to allow yourself to go through a mourning period. You likely did not want to get to this place. You likely have been through an experience and then a diagnosis that you didn't want to have. And you need to allow yourself some time to accept that and to mourn that, especially, in my opinion, if there's a hysterectomy involved. For me personally, I had to do a lot of mourning around the fact that we couldn't have more kids, that it was the end of that journey, a lot of things. And I think that's a really important step to go through. So whether you're going to go through it now or possibly after you decide to have surgery, whatever it is, allow yourself that time a little bit to go through that mourning. So once you've kind of accepted those two things, then you can say, okay, am I at a place that I think surgery is the best next option for myself and for my own health journey? That's really what you're asking yourself. Is surgery the next best step for you? Because the other thing to know is it's not the end step. Like, having surgery is just a jumping off point to the next part of the journey, right? There's still a lot that comes after that. So is surgery the best next step for you? And only you know that. And again, take the pressure off that you're going to know it 100%, because you won't. But is it the best next step for you? And I'll tell you, for me, what happened is I simply got to the point where it was worth it to me to go through the risk of surgery to see what the possibility was afterwards. I had lived with a bulge, grade 3 and grade 4 prolapses, for 7 years. And I was 41 years old, I believe, when I had surgery. I knew we were done with kids. Like I said, medically, we actually could not have more kids. I was done nursing. I knew the next phase of my kind of journey was coming. I had had 2 kids. I had nursed both for 2 years. I'd had a lot of time living with a prolapse, but also my body changing. And I knew that time was kind of over. So I knew that it was the next step for me was simply to gain information. I was done nursing our final baby. And I said, I just want to know what's next. I haven't really gone into this yet because it wasn't a possibility for me yet because I was still having kids. So let me get some information. And that was the first step. And that's all you have to do first, right? It's just take that first step, which is seeing a urogynecologist. That is who you need to see. Do not see an OBGYN for this. See a urogynecologist. They are the experts in this area, and they are most likely the person who will be doing your surgery. Have a consult and see as many as you need to. I saw 2, and they were actually in the same practice because I liked the practice. So I saw 2 just to get information. I have worked with many clients who I have recommended they get a second opinion because the first opinion said, you need surgery tomorrow. I mean, it's amazing to me how many people I've talked to who the surgeon says that just immediately, like, oh, we'll just do it tomorrow, no big deal. Well, nope, talk to someone else. You have time, okay? You have time to figure this out. There are occasions that this could be an emergency surgery, and I know that, and you might be in that situation, but again, you would know that, okay? The doctor would be explaining that to you. Unless it is truly an emergency situation, we're talking you're hemorrhaging or you have some kind of growth or something is going on that you need emergency surgery, okay? Unless that is happening, then don't let someone pressure you into making a fast decision. You have a little bit of time. Like for me, I had lived with it for 7 years. I could take 6 months to figure out what was best for me. And so have your consults, gain your information, ask your questions. When you go in to see the surgical consult, I want you to have a list of questions written out, and I don't want you to leave that appointment until you get them all answered. Questions that you may want to ask are things such as, what exactly are you going to be doing? And truly, I know that seems simplistic, but it doesn't get explained to us. And again, I cannot tell you how many clients I've seen in my life who I ask, what kind of surgery are you having? Or afterwards, what did they do? And they say, I don't know. This is your body. Find out what they are doing. What are they fixing? How are they doing it? Are you having a vaginal surgery? Are you having a laparoscopic surgery? How long might you be under anesthesia? Ask these things. It's your body. And if you don't understand the answer, ask them to clarify. Find out what they're going to do. Find out what recovery might be like. Okay, be specific. Ask them, am I going to wake up and stay overnight in the hospital? Am I going right home? What can I expect from medication? How long might I be on medication? Will I have a catheter? Those are things you might want to know. Find out things about your job. If you are working and you need to take time off work, gain that information. Again, it's just going to be helpful for you to make a decision. I know some people have to make a decision based on the season, either because of their job or their kids or those kind of things. I ask questions about lifting. That's a really important one you'll want to ask. So about workouts, how long am I not working out? What exactly are my restrictions? When can I start again? Those are all the things that you want to be asking. Okay, so those are things to know beforehand that will help you make your decision. But again, then allow yourself to take time. Ultimately, only you can make this decision for yourself, and you get to decide how long it takes before you make that decision. And I think there are benefits either way. I think you need to get to a place mentally that you're ready to accept the surgery and that you believe it will work. Again, with all my experience as a PT, the people who had the best recovery are the ones who went in believing it would work. If you go in and you're still in a place of mourning and fear and being upset, being bitter and resentful about it, you will have poor outcomes. Research actually shows us that. So give yourself time to get to a better place. And that's completely fine and understandable, but give yourself the time to get to that place. Things such as if you're in the middle of caretaking for an elderly family member, do you maybe need to give yourself a few extra months? There are life circumstances that are going to be different for all of us. For me, my kids were a certain age and I really needed to kind of make a decision around that. I didn't want to wait too long and not be able to hold them anymore. But I also didn't want to do it too soon after quitting nursing because I wanted my body to recover. You probably are kind of understanding here. We all have these different nuances to our lives and what time might be best and might not. So ask your surgeon too, is there any difference if I wait to do this? I remember asking that, what's the con if I wait 5 more years? And again, only you know your situation, okay? So those are questions to ask, and just know you can take your time to make the decision. And then once you do make that decision, own it. Say, I'm going to step into this. That's what I decided. I made the decision. I journaled. I worked through it. I prepared myself in every way possible for surgery. I made sure I was hydrated and healthy and at a good place mentally. I prepared freezer meals, so I was ready to go. All of those things you need to do before surgery so that you have as much peace of mind as possible going in, and that you accept that it is the next stage of your health journey. So you've done all of that to prepare. And now let's talk about the different types of surgeries. So you've done kind of your preparation, but you're still in that place of asking what kind of surgery you might get. There's 2 main types of surgery for pelvic organ prolapse. One, and I'll cover it first, but it's very rare. It's called obliterative surgery. And again, I know it's out there and I think people hear horror stories about it, but please know it is very rare. And what happens is they actually narrow or close the vagina. And that's done to simply, the bulge can't come out anymore. Your vagina is closed. And it's done if the prolapse is so severe and the client doesn't have any other options for surgery. you can never have sex again in this case. And again, it's very rare. So please know that that is a very rare case. Most pelvic organ prolapses are called reconstructive surgeries. So what they do is they go in and try to fix the tissues in some way, shape, or form so that they can do their normal job of holding up your organs again. This is reconstructive surgery, and this is the most common. So you'll want to find out what type of reconstructive surgery is being offered. And this will, again, change depending on what type of prolapse you have, the grade of prolapse, your age, your situation, the surgeon themselves, and what they are capable of and what they're an expert at. But a few options is something called fixation or suspension using your own tissues. So they use native tissue. Native tissue means it's your own tissues. And that's to treat uterine or vaginal vault prolapse. Okay. Another one is called colporaphy. It's used to treat the prolapse of the anterior wall of the vagina and the posterior wall. So let me break that down for you. Actually, let me just tell you all of them, and then I'll come back in layman's terms. Okay, that's colporaphy. Sacrocolpoplexy. I know these are big words. Sacrocolpoplexy. That's used to treat vaginal vault prolapse, and it is done when surgical mesh is attached from your sacrum to your cervix to lift everything up. And then hysterectomy typically is done for uterine prolapse, many times with some of these other surgeries. So let me go back for a moment, okay, and answer some of the questions you're wondering, because your brain might be fluttering all over the place. So I'm going to cover the colporaphy first, because it's a big word for what is typically done. If you have a bladder prolapse, that's anterior. That's a cystocele, okay? If you have a rectal prolapse, it's posterior wall. It's called a rectocele. They will use this colporaphy to fix both of those. And I had both of those done. So basically what they're doing is they are stitching together that tissue. They're kind of cutting out all the loose tissue and they're stitching and pulling it together to make it tight again so that your organs are held up. And they'll do it anterior and posterior, okay? Depending on what you have done, what you need done. So that is that piece. And I consider it a reconstruction of the vaginal wall, either anterior or posterior. I also had a sacrocolpoplexy. So that's why I'm going to cover these first. Sacrocolpoplexy, not quite as common because I also had a vaginal vault prolapse. So again, if you listen to the previous stories, you'll hear me talk all about it. But just to kind of summarize again, I had grade 3 and grade 4 bladder prolapse, rectal prolapse, and a uterine prolapse with some vaginal vault prolapse with that. So I had the anterior wall fixed, posterior wall fixed, and then sacrocolpoplexy, which is surgical mesh that's attached from your tailbone and sacrum down to your cervix to keep it all lifted up so it doesn't prolapse down. And then I also had a hysterectomy, so I had my uterus taken out. And then let's go back to that fixation or suspension using your own tissues. That would be similar idea to the sacrocolpoplexy, except the main difference is native tissue versus mesh. Okay, so they're going in and lifting things up. If you need things lifted up, you could either use native tissue or use mesh. So those are the main types of surgery. Then you would ask, like, how are you going to do this exactly? Sometimes it can be done vaginally, okay, so right through the vagina. And then sometimes you will have a laparoscopic surgery. Those are the incisions in your abdomen. And then occasionally you could have an incision itself made across your abdomen. And let me give you an example. So for me, with all of those procedures, I had a laparoscopic surgery and then vaginal as well. So I think they went in vaginally and fixed whatever they could that way. But I also had to have laparoscopic surgery for the hysterectomy piece and the sacrocolpoplexy piece. So I came out with 4 holes, which I have like 13 total now from all my surgeries. So these are holes on my abdomen. But I was told beforehand, hey, just so you know, we are going to most likely be doing this laparoscopically. But be prepared, because if we find a large fibroid or if there's something that we can't get out through these little holes, we will have to give you an abdominal incision. And I've seen this with clients before too, that occasionally they'll wake up and they'll have an incision, and the surgeon will talk to you about that. You might want to ask beforehand, but sometimes that will happen if they find things that they just didn't expect to, or if the surgery takes a little bit of a turn. So those are the different types. Now, let me answer a question you probably have, which is the mesh question. I have an entire YouTube video, by the way, about mesh itself. I will just tell you a couple things here. One, the mesh used during sacrocolpoplexy is not the scary mesh that has been outlawed and isn't used anymore and was a part of all of those lawsuits. I was a physical therapist when that was happening in the early 2000s, when women were coming in with mesh being broken down and having pain and major surgeries and problems. Okay? I was a part of that. So believe me when I say mesh scared the heck out of me, the idea of it, because I saw all that. So I had to do my own research, which I'm more than happy to do, and found out and talked to my doctor. This is surgical mesh that is not used in the vaginal wall. That's the mesh that we have problems with, is if they're using mesh in the vaginal wall itself to hold it up. This is surgical mesh that is very small and is attached from, again, sacrum and tailbone down to your cervix. So it's not a part of that scary lawsuit mesh that was going on a while ago that still shouldn't be used in surgeries. This is a little different. The other thing to know is there's like a pro and a con to it, to native tissue versus mesh. And again, you just have to decide what's right for you, but also it's what your surgeon does, what they're an expert in, what they recommend. Surgical mesh has a less percentage chance of recurrent prolapse. All right. If you use native tissue, you will have a higher percentage chance of your prolapse coming back. That's one side of the coin. The flip side is you have mesh. So you have a small percentage chance of complications from mesh that you would never have with native tissue. I'll just lay that out for you, and you have to decide what's best for you. And again, for me, it basically came down to my surgeon and what they were an expert at and what they recommended, and then me doing my own research and my own consults, and that's the decision that was made for me and by me. So those are the different types of repairs that you may or may not have done. And then sometimes with all of this, they'll do a bladder sling as well. I did not have that. And the way they decide that is they will do a bladder avoidance test. Your urogynecologist will do a bladder avoidance test, and they'll decide and be able to tell you exactly what dysfunction you may have in the bladder and if the bladder sling is something that may help. So I did the bladder avoidance test, and it actually had better bladder function than we expected, so the bladder sling was not appropriate for me. So I didn't have that piece done. Now, I want to take a quick moment to pause and acknowledge that I've said a lot of big, complicated words. I also acknowledge with that again, I've been in the medical field for a really long time. And so I can personally, and I know this and I'm acknowledging it, I can read through the research. I can pull things up online. I feel like I can pick out information that's appropriate. I know what questions to ask. So I definitely don't want to come at this from a place that you feel like this should be easy, because I know it's not. And if your brain is whirring around and spinning, I totally get it. I mean, like I said, I've been in the medical field a long time, and I had this procedure 4 years ago, and I can still barely say sacrocolpoplexy, and I don't think I could spell it without looking it up. So these are a lot of big things, and I've had a lot of surgeries. So if this is your first surgery ever, it is okay to feel like you are in a whirlwind. Take notes, listen to this over and over again, and that's what I recommend. You have to be an advocate for yourself. I have a podcast episode on that too if you need it. You have to be an advocate for yourself. You have to write things down, ask questions, and also bring in someone if you need it, okay? Make sure someone else could be an advocate for you. I know I personally do virtual consults with people all the time after they've met with their surgeon, before they have surgery, just wanting to talk through it all. And I love doing that to help support people. So there are people who could be on your team. See a pelvic floor physical therapist, get them on your team, ask questions. So don't be afraid to bring someone in to help you navigate this choice. You're not alone doing it. All right, we're going to move on to what to expect after surgery. So just a few things to expect. And especially if you've never had surgery before. So the first thing to acknowledge is if you have never had surgery, then this is just going to throw you for a loop because surgery is gnarly. It just is. And I'm going to lay it out there for you and tell you. I've had 4 major surgeries under anesthesia, staying the night, and each one of them is just gnarly in its own way. And I think by acknowledging that, you can go in with a little more of a realistic expectation than when surgeons say, oh, it's just a hysterectomy, no big deal. Well, it is a big deal. It's a big deal for you. Don't let someone tell you otherwise just because they perform 4 hysterectomies a day. I bet they've never had one done on themselves. So acknowledge the fact that it is a big deal. You deserve to have your questions answered. So a few things to expect afterwards. 1, just know anesthesia will throw your body for a loop. Like I said, just the anesthesia alone. You will not feel like yourself just from the anesthesia for about a month, I find. And it can just do crazy things. It can give you headaches. It can make you have brain fog. You can have some confusion. I find you can get really emotional. All of those things just from the anesthesia. So again, I think it's just good to acknowledge it and kind of be prepared for it. So just know that could happen. Also, with these kind of surgeries, typically they use gas in your abdomen. They'll pump your abdomen with gas because it gives it more space so they can see what they're doing. And that can cause some strange pain afterwards too. Like you can headaches and then a lot of pressure and pain up in your collarbone as the gas moves up. I was so thankful my very first surgeon actually told me that years ago so that I knew what to expect. And then after my second surgery, my week after surgery, I just told my husband, like, my neck is killing me. I don't get it. And he said, don't you remember? Don't you remember after your first surgery, the gas? I said, oh yeah, I had completely forgotten. So it's good to have someone there to talk through with you because they can help in those times of brain fog. So the gas is good to understand. Again, know afterwards, like when are you returning to your job? What exactly are your restrictions? Typical restrictions for after the surgery is no lifting more than 10 pounds for 10 weeks. Okay, that's just typical. Everyone could be different, but that is the most typical restriction. No lifting more than 10 pounds for 10 weeks. And I have an entire 10-week post-surgery exercise program. I'll have the link for that below too. I highly recommend it. Please know that things will happen on their own timetable. Okay? You will have neighbors who had a hysterectomy and will tell you, oh, I was back to doing everything I wanted to do in 4 weeks. You will have that. And you may not be that person. And I was not that person. And prolapse repair is so different than just a hysterectomy. And so take your time. I did not feel like I really had freedom over movement in my body for a year. And I know I'm a little different because I film and I need to teach and those kind of things. But it took a year before I really felt comfortable and safe, a year after surgery, before I really felt comfortable and safe choosing to exercise and do what I wanted to do. But I did move every day during that year in some small way. It has to be purposeful and intentional. But just know it can be there and it does take time. So be patient. Be patient and consistent. And then a big one, if you've listened to me for a while, you know this. A big one I will tell you about is constipation. It happens after surgery because anesthesia actually makes us constipated. And then they'll put you on pain medication for a while and that makes you constipated. So complete honesty here, too much information. So if you don't want to hear this, skip ahead. So this was definitely the hardest of all of my surgeries. And I know it was the prolapse repair piece. I had a lot done and I know that. So it was hard and it was painful for the first week, especially afterwards. And then also about 3 or 4 days after surgery, I was having, a lot of pain, like on the bathroom floor crying periodically. And I couldn't quite figure it out. I just thought it was part of recovery. And then about a week after surgery, I realized I hadn't pooped yet. I said, oh gosh, I really need to make that happen. I called a client of mine who's an OB and talked to her. I talked to my doctor. They both agreed I would get an over-the-counter and drinking enema, something I had to drink just from the drugstore. And I drank it at night and put my kids to sleep. My husband went to sleep and I was up the entire night. I was awake downstairs. I remember literally like I was giving birth. That is the only thing I can compare it to. And I've given birth twice. And it didn't hurt quite as much as that, but it was pretty darn close. Like I would walk around, I was having cramping. It was awful. It was awful. On and off the toilet. And once, I think it was probably 4 a.m. by the time it really took hold and it all came out. And it was the most painful bathroom trip I've ever had. But afterwards, it was night and day difference. Like I felt so much better and those sharp pains were gone and I could just focus on recovering from the surgery. It's not like the surgery pain was gone. That was still there, but those sharp, crazy pains were gone. It was literally like I gave birth to what had to be done. And I say that because I don't think we talk about these things. And so I'll lay it out there and tell you. But you really do need to prepare for that because it does happen after every surgery because of the anesthesia. And then when you have work done on all of those organs, right, they're all being moved around. We're talking bladder and intestines and colon and rectum. Of course, things are going to be hard. It's hard to pee. It's hard to poop. It can feel weird. Maybe you'll pee a lot. Maybe you won't very much. Maybe you'll have urgency. There's so much that's done down there that you really need to tune into your body and let go of all embarrassment. And you need to either call your doctor, make it happen, do what you need to because you can feel better. But also, health things can occur if you are not using the restroom the right way. If you are not urinating for a day, you need to get to your doctor right away. Those things can happen after surgery. So I'm not telling you to scare you, but just to make sure, because this has happened too. I've had to talk to clients and say, you need to get to your doctor now. It's not normal to not go to the bathroom for this amount of time. So ask those questions. Let go of all embarrassment and shame. Like you have got to leave your modesty at the door and know that this is your body. You get to ask whatever questions you want. You deserve to know the answers. You get to find out what's going on down there. Don't leave it aside. Own it, right? And then if you have someone in your life who can listen to you and talk to you about these things, it is so, so important and valuable and will help your recovery long term. So I don't really feel like I should end the podcast on that story, but I'm going to because we covered it all and it feels a little bit appropriate because how I feel honestly is that we do have to laugh. We have to laugh a little bit through this. Otherwise, it is just too hard. And it really is kind of a microcosm of what this is about, which is again about your body and being able to embrace it in all of its different stages. And the way I pictured this, and I had this visualization when I told you about having to mourn a little bit and accept that this was the surgery I was having. I wasn't just accepting the surgery. It really was that I was entering the next phase of my life. I was done with babies. I was done nursing. That was hard for me. I was 42. I really visualized myself as a phoenix rising out of the ashes, that I would be stronger, that I would fly with victory and find my strength. And I knew it would take time, but that was the visualization I had. And I really encourage you to find some kind of place like that, right? I was that phoenix. I was an injured phoenix. I might have had some broken wings that needed to be fixed. And it took time, a lot of time. But have that idea or that goal of being even better than before, being even stronger than before. And people ask me sometimes if I ever either regret having surgery or, are you so glad you had it? And that's a really hard question for me because when someone asks, are you so glad you had surgery? I mean, my answer is really, I just wish I never had to have it. I wish my body didn't break a long time ago. I wish I didn't have to have it. But I did. And I did have a prolapse. And so no, I have never had a regret. That I can say for sure. I personally have not once regretted having that surgery. That being said, I told my husband before surgery, I said, for the 2 weeks after, I'm going to look at you and say, why did I do this? Because I was living a life. I had a bulge all the time. I wasn't comfortable. I was limited, but I was living my life. And I knew in those moments of recovery and pain, I was going to wonder what in the world I chose to do. So I told him beforehand, I said, when I look at you and say that, remind me why I did it. I just need you to remind me. And he did, because I did have those questions the first 2 weeks after. What did I do? Why did I do this when I couldn't even walk one block? I'm like, what was I thinking? But you get through that, okay? You absolutely do. One day at a time, you get through all that and you eventually feel better and you start to feel like yourself and you can walk up and down stairs. And I remember the moment I could run across the playground with my kids. And I remember waking up from surgery, the moment I woke up and I didn't have a bulge. And that alone kind of made it worth it. It did. So 4 years later, I am doing well. I'm doing great. I think as of now, I'm a success story. I have never had a bulge again, knock on wood. I can do most exercise. I don't run for the most part. I will do trail runs. And again, you can listen to the exercise podcast for the details. I'll do a trail run about once a week. Running doesn't feel great still, and I'm okay with that, but it's not something I choose to do much. I can't jump rope at all. I will immediately pee my pants, so I don't do that with my kids. But I can choose to do just about anything else that I want to do. I focus on what I can do. Again, I don't have a bulge. I had tailbone pain for about a year after surgery. It's not that common, but I had it. It occasionally will come back here and there. I still urinate quite a bit, but not nearly as much as I did before. So I think for me, it just was important to know, like I said, it wasn't the end of the journey. It wasn't the fixing in the end. It was just the beginning of the next phase. I still have to make sure that I stay healthy. I still have to manage a prolapse because I do not want it to come back at all. So I still manage it, definitely. But yes, I am much more free than I was before. I don't have the bulge, which is amazing to me. And I've learned so much about my body. So no, I have never regretted it once. And I also believe doing all the work that I did prior to surgery helped me get to this place. I hope all of that helps. I hope it truly does empower you. I will have the links to all of the resources, as I said, below. And I will continue to be here to support you on your own journey. I'll talk to you soon. Thank you so much for joining me today on Meet Your Body. If you have a moment, please consider rating and reviewing this podcast as it helps us tremendously. For more resources and workouts, you can visit my website, jessicavallantpilates.com, or find me on YouTube or Instagram at Jessica Vallant Pilates.